Hi, in this video, I'm going to show you how we help patients with nerve damage symptoms such as numbness, burning, and tingling sensations without using any drugs or surgery. My name is Dr. An. I'm a doctor of chiropractic and a nurse practitioner at Campbell Health Center. We've been helping Houston residents for the last 20 years, and we have over 600 Google reviews of highly satisfied patients. You might have gotten the diagnosis of neuropathy from another doctor, or you may not. Even if you have not been diagnosed, this video is for you if you experience these nerve damage symptoms. The symptoms might have started out as a faint numbness or burning that used to go away, but now they're constant and don't go away. Many patients report that the pain, numbness, burning feel worse at the end of the day. Some patients also describe the sensation as spongy or feel like walking on pebbles. You might have tried rubbing your feet or applying creams, or your doctor might have prescribed medications such as gabapentin, but it doesn't seem to help. They may have already started affecting your balance or ability to walk or interfere with the activity that you enjoy, such as walking, exercising, doing hobbies like fishing or playing tennis, or even just playing with your grandchildren or grocery shopping. If you're diabetic, perhaps you're concerned for the risk of amputation. According to CDC, up to 10% of patients with type 2 diabetes will experience limb amputation. You might have been told that you have neuropathy and that there is nothing that can be done and you have to live with it. Perhaps you're watching this video because you don't want to accept that you have to live with it, or you're tired of taking medication that don't seem to help. If this is you, then I'm glad that you're watching this video. This video is not for someone who's looking for a magic bullet. This video is also not for someone who is looking for a treatment that is covered by insurance and is not willing to invest on their health. If you're closed-minded and you're not willing to try, that's not pharmaceutical drugs or surgery, then you can stop this video now. But if you're still here, you're about to discover regenerative, holistic approach to restoring nerve function. From treating the nerve damage symptoms for so many years, we have identified the top most common causes of neuropathy. Approximately 30 to 40% of our patients come to us with a nerve damage caused by type 2 diabetes. I have to point out to you that type 2 diabetes takes a long time to develop, and a lot of our patients also come in with the neuropathy symptoms before they receive the diagnosis of type 2 diabetes. These are the patients who are on the way to becoming diabetic, and their neuropathy symptoms start before the diagnosis. So why does having excess sugar in your blood cause nerve damage? What happens when sugary things such as candy and chocolate melts in your hand? They become sticky. So your blood gets exposed to excess sugar, it becomes sticky, and in turn causes circulation problem. This is the reason why diabetic neuropathy starts in your feet first, because it's the part of the body that's most away from your heart. It will eventually spread to your hands as well if left untreated. Another 30 to 40% of our patients also come in with problems in their spine. I believe this is the most underlooked part of neuropathy care. As we age, the disc or the cushions between the vertebrae shorten, causing compressions on the nerve root. Many of these patients have chronic history of back pain. Some might have even gotten back surgery years ago. If this is your case, your spine needs to be rehabbed before we can improve your nerve damage symptoms. So diabetes and spinal problems make up to 80% of all our patients we see. Some of the patients have diabetes and chronic back pain as well. Now the rest of them are patients who develop neuropathy from cancer treatment. Some have a history of alcoholism and trauma such as fracture of the foot or the surgery. So the conventional medicine way of treating neuropathy is first the doctor may order a test called NCV EMG testing. They stick a needle into your legs and your hand and wiggle it around. It's a pretty uncomfortable and painful test, and if you've ever had it done, you will know that you had it done. And once the test is done, you will be given the diagnosis of neuropathy, and the doctor will likely recommend you a medication called gabapentin. Well, let's Pause a moment here and think about it. Does gabapentin address or improve diabetes? Does gabapentin improve the problems in your spine? Or does it remove the toxins from chemo and radiation therapy? No. This is the reason why drug therapies for neuropathy often doesn't work, because it doesn't address the root cause of the problem. Well, then how do we restore the nerve function? I have created what I call a 5 pillars of nerve reboot program that improve blood flow and nerve function in the feet or hands. These 5 pillars address the appropriate root cause of the patient's neuropathy. The first part of the 5 pillars is a use of a treatment called regenerative medicine. We are going to harvest plasma from your own blood. It's a process that takes about 20 minutes, and your plasma from your blood contains many healing regenerative properties that can help restore the nerve function. The second part of the 5 pillar is a in-office therapy where you come in a couple of times a week, and we utilize treatments such as laser treatment, decompression therapy, and shockwave treatment that will help restore the nerve function and blood flow in the damaged part of your body. The third part of our neuropathy involves a home care. We may prescribe you a treatment that you can do at home on the days you're not coming into the clinic, so you can continue to improve. And the fourth part of our treatment also involves a pharmaceutical grade, very high quality natural supplement that can help you improve your diabetes, reduce inflammation, and improve the blood flow. And lastly, we have a very simple, easy to follow diet guides that help reduce the inflammation, help restore the nerve function, and will likely to improve any diabetic conditions as well. After we achieve the relief and improvement of function, we may continue to monitor and rehab you monthly for a period of time to make sure that you retain your improvement and you protect this gain that you have achieved over several weeks. Some of you have been suffering for so long that you don't even remember what life was like when you didn't have this problem. If you have come this far, you have one of the 3 options that you can choose. Option number 1 is to continue to do what you have been doing, most likely taking medications such as gabapentin and other medications. Are you aware that gabapentin is a seizure medication that slows your brain's activity down? Because of that, it can cause memory problem, and it also has the high warning from the FDA for its side effect of sudden stop in breathing. A lot of our patients expresses the feeling of being gabapentin as being like a zombie. Second option is you can choose to do nothing and take your chance at where these symptoms lead to. The term often used to describe nerve damage is progressive peripheral neuropathy. You've been having these symptoms a while now. You can do nothing and take a chance at where it leads to as you get older. And of course, the third option is to take an action to do something different. We have helped hundreds of patients turn their lives around and improve their quality of life.
Hi, my name is Joel Munguia, and I have knee problems.
I've had 3 surgeries up to this point, and I was in such pain, couldn't do anything. My life was just awful.
So I tried muscle relaxers, I tried just ibuprofen 800 milligrams, but honestly that didn't really do anything.
Because I was in so much pain, and nobody knows what you're going through unless you experience what I experienced.
Well, after about the 3rd treatment, my feet and legs were very much better. After the 10th treatment, I was walking like 10 years old again.
When I first came here, I could barely walk for 5 minutes without having to, take a break. But I'm able to walk, I'm able to sit, I'm able to do my job very comfortably now.
I've got my life back. My husband thinks I'm a spring chicken now. And friends have said, "You're different, you look taller," because I can stand up straight now.
It's like you're willing to spend money on your cars or apartments or anything. Spend money on your body because it's well worth it. I have seen results in these last 3 weeks, and they're not giving up on me. I still got more treatment left.
I have dedicated my life in helping patients get better without using drugs or surgery. I travel all over the country to bring the latest and the best treatment. I want to help you live your life without limit. Your best life is ahead of you. We hear it all the time from our patients. If I knew I would live this long, I would have taken better care of myself. If this appeals to you and you're still with me, I want you to click the button and book the new patient special. Some patients do come in too late. It is not a pleasant conversation to have, but once or twice a week, we have to tell a patient that they've come in too late. Don't let that be you. If you qualify for this type of treatment, we'll recommend you a program that addresses the root cause of your problem. If you don't qualify, then we'll tell you so you have nothing to lose. See you soon, and I wish you the best.